Hey, so which one wins? Medicare Advantage, Medicare Supplements? If you are seeing the doctor often, this is going to be the greatest video for you to be able to watch because I'm going to walk you through. Just because there's a lower premium doesn't always mean the outcome of copay costs and things that you pay on Medicare Advantage plan is going to be best. We've seen a lot of people hold thousands of dollars when a Medicare supplement plan was the best fit for them. Stick around, I'm going to walk you through the 5-number test to make sure you know which to choose, a Medicare Advantage or Medicare supplement, and understanding both. So let me cover the 5 really main things or 5 numbers you need to be able to look at when it comes to a Medicare Advantage or Medicare supplement plan. And often these are not explained correctly. We like to explain them correctly. So somebody is enrolling into a Medicare Advantage plan, they know what they're liable for or responsible for up to a max out of pocket. But one, just what is their premium? Is there a zero premium? And then if it's zero premium, it doesn't mean the cost of service is zero. You need to understand the summary of benefits. We're going to talk about that in just a second. And then 2, your access to specialists, your access to diagnostics, routine blood work, lab work, x-rays, diagnostics like MRI, CAT scan, PET scan, PAT scans, anything that outpatient surgery, like outpatient surgery in a freestanding clinic as opposed to a hospital outpatient. What am I paying when I go into the hospital? What copays am I going to pay? High ticket services. So this is one of the things that I always tell people. We have had people that enroll into Medicare that had a missing arm or a limb, and they have to file and get that covered under durable medical equipment, which means they're going to pay 20% of the billable for that leg or for that brace or for that arm. And so that can cost thousands of dollars, and 20% of that can cost thousands of dollars to the Medicare beneficiary. So just being aware of high ticket items. Another one is chemotherapy, treatment for Part B drugs. Chemo and radiation is probably the highest ticket item for most Medicare beneficiaries. 1 in 3 of you guys are going to have cancer over a lifetime. And if you're 65 years of age and older, if you're enrolling into a Medicare Advantage plan, we encourage our clients to pick up a copay plan or an indemnity plan that covers the hospital costs and the high ticket items like Part B chemotherapy, Part B radiation at the first diagnosis of cancer, and it covers the what you'd call as the max out of pocket. All Medicare Advantage plans are going to have a maximum. So just being aware, the total drug cost, this is so important right now because drug costs are all over the place. Just because you've been on a great plan doesn't mean you're on a great plan right now or going into a plan that's going to be great for your medications. Making sure somebody's looking at your doctors, your specialists, your access to health. What is it going to cost you? I usually can talk to somebody for a few minutes. I like to tell people I don't have a crystal ball, so I can't see into the future. But I can usually, like this person takes care of themselves and they're willing to not pay a premium and they're willing to accept the copay charges on the Medicare Advantage plan up to the max out of pocket. And if they understand that, a Medicare Advantage plan is great. And then other people are like, hey, I don't like changes. I like simplified premium, and it picks up. So if my house burns down, my insurance is going to cover it. I'm not paying any cost of that for catastrophic things when it comes to like that major insurance on a automobile or a house. Well, Medicare Advantage plans, you're going to participate in paying a percentage or a copay amount. So you need to understand what that is, as opposed to paying like a premium for a supplement and it picks up 100%. I'll be back in just a second to go over the next one. So Medicare Advantage pros and cons. One of the biggest things is don't be swept into zero premium because it has extra benefits. You need to weigh out exactly what those extra benefits are depending on the state, the county, and where you live, what plan is available in your area. It really depends on a lot of factors that you need to look at, have somebody objectively look at it and not subject you to enrolling into a plan just because it's got bells and whistles like dental, vision, hearing, and over-the-counter benefits, and it doesn't cover exactly what you need. And then also making sure with these network changes, your max out of pocket and exposures, just, like a Medicare Advantage plan is going to expose you to some cost. If you know what that is, they're great plans. If you don't know what those are, it's a surprise. In enrolling into a Medicare supplement, typically, we usually have a line item, some questions we ask, and if people answer yes to those questions, I suggest, hey, you definitely need to be on a Medicare supplement. One, if you're chronically ill and you're turning 65 and going on to Medicare and you're going to have major issues with your health, enroll into a Medicare supplement. You pay a premium, it picks up the cost, and you don't have to worry and you're not stressed. If you're healthy and you're going to live in the area and access care and you understand the Medicare Advantage plan, great, that's okay. Or if you just like to, again, pay a premium, it picks up and performs, and you don't have access to care issues, a Medicare supplement obviously is going to be a great fit. Either one can work if you understand. Medigap pros and cons. One of the biggest things that we've seen with the cons of Medicare supplement plans over the last 2 to 3 years is premium rate increases are soaring through the roof right now. Some of you guys have experienced 10, 25, 40% rate increases. If you are still healthy, I would say call and let's review your health plan options for your given area. Medicare supplements, you can enroll and change your plan 12 months out of the year. So if your premiums are going up, you may be able to enroll into another carrier at a lower premium and saving several $100s. We've seen people say up to $1,000 or $1,500 in a given year on their premiums. It just depends on the area that you're living in. Why are these premiums going up? Well, the major reason right now is a lot of states are attributing this new birthday rule. It's not new, but they're allocating the birthday rule. And that means if you, every birth date every year, you can choose in that given time period that the Medicare supplement allows to enroll into a different Medicare supplement carrier at a lower premium. Well, guess what that means? That means somebody that's sick, if half the population is on Medicare Advantage and half the population is on Medicare supplement, a portion of that population is going to be sick, and it's creating higher risk for the Medicare supplement carriers. Therefore, guess what? They're going to raise the premium to reduce their risk of liability of loss when it comes to medical loss ratios. So the premiums are rising with that and some other factors of pros and cons, but 12 months out of the year, if you're on a supplement, you can quote a supplement and rewrite on another supplement at a lower premium if your health allows you to be able to do that. Now we're going to dive into the 2026 context of some other things that are very important for you to understand. So one of the other major things is just being aware of your Part D coverage. And in coming January, if you was not educated correctly on your Part D deductible and you're on a Tier 3, Tier 4, or Tier 5, guess what? You are going to pay a Part D deductible. Or throughout the year, if you're paying zero copay on Tier 1 drugs, and now all of a sudden you have a Tier 3, Tier 4, Tier 5 drug halfway through the year, you're going to pay that Part D deductible on your plan. So review what your Part D deductible is through the summary of benefits or evidence of coverage. If you don't know, you can always call and ask us. If you don't even need to change, you're just unaware and you don't have a licensed agent to work with, we can inform you on what that is. But you need to be aware, because then what's going to happen is health plans are pushing people to more and more generics, Tier 1, Tier 2. But there's a lot of times, like Jardiance and things like that, there's not a generic available. Therefore, they're going to put you on the name brand drug until a generic is available. So the doctors will typically align you with generics if available. If not, and the need requires for a Tier 3, Tier 4, Tier 5 drug, you're going to be subject to a Part D deductible. That can be a game changer for some of you guys, because again, those can range anywhere from $100, $200 all the way up to $625 is what we've seen in most of our markets for Medicare Advantage and prescription drug plans. So be aware of the Part B or Part D as in Delta deductible. So in light of this, Medicare Advantage PPO plans, we are seeing a huge suppression of PPO plans. So just be leery if you're enrolling into a Medicare Advantage plan. Is that a stable plan? We have a plan right now, a carrier that's been here in our market for years, and their PPO carrier is very stable. Then we saw other plans in this market, and given all the contiguous states touching Tennessee that had PPO plans that are not stable and not sustainable. And so now you're going to see a big swing into Medicare Advantage plans offering more stable plans through HMO plan offerings. Most people don't understand the difference of HMO and PPO. I talk about that in other videos. I would encourage you to be educated properly. HMO plans work great if you understand how the plan works, the network works, and then PPO plans are not always effective because out of network is going to be higher cost, and then the doctor has to approve to bill your plan for PPO coverage. And a lot of times doctors, hospitals, and facilities will not approve your PPO plan, and therefore they can't bill. And if they don't bill, you don't have coverage, even though you have an out-of-network benefit. You can always be covered with all Medicare Advantage plans for emergency or urgent care. Now into the next point. For you guys that are, in a sense, lightweight when it comes to health needs, Medicare Advantage plans again can work. If you are medium, like, hey, I have health risk, but it's not a lot, I'm going to the doctor a few times a year, Medicare Advantage or Medicare supplements, either one can work. And then if you are in a kind of a complex medical condition, you're aging into Medicare, or you're on a Medicare Advantage plan right now that's coming out of the market and you qualify for a special enrollment, a guaranteed issue for a Medicare supplement, my encouragement would be enrolling into a Medicare supplement is the safest thing for you right now, especially if you're going through treatment, going through a situation, maybe on the other side. If you wanted to drop the Medicare supplement, you can choose to do that. Again, a Medicare supplement is an underwritten plan. Your guaranteed issue when you are your initial enrollment period, when you turn 65, you can go on without any underwriting questions. And then if you're losing a credible coverage with Medicare Advantage or prescription drug plans, or you're coming off an employer-based plan that's credible coverage equivalent, you can guaranteed issue into a Medicare supplement without underwriting. And some of the rules kind of apply a little bit different with the Medicare supplement, so you need to ask. But the point of that is, if you wait until that guaranteed issue windows are gone, then you're going to have to succumb to underwriting questions. And underwriting questions sometimes can disqualify you based on your health. So my encouragement would be, if you have complex health situations going on, is to look at a Medicare supplement. If you're dealing with an agent that only markets and promotes Medicare Advantage, you have a problem, because guess what? That's all they do. If they can't talk to you like I would on a fluid basic knowledge and understanding of Medicare Advantage, Medicare supplements, if they're always, well, you don't want a Medicare supplement because it costs premiums and it goes up. Well, Medicare Advantage plans have copays and they have some restrictions. You have to get prior authorization. So again, if you don't have somebody that understands both and educates you properly, you need to be able to make a decision based on your fundamental needs when it comes to your health, access to care, and does it cover your doctors, your specialists, your medications, your plan needs, and everything wrapped up in that is a huge checklist of things. We like to be able to simplify that for hundreds of thousands of people every year. We'd love to have the opportunity to schedule a time with you. Guys, we're here to be able to make your life easy by making Medicare simple. If you don't have a licensed agent or agency, we'd love you to be able to reach out to us. We'd love to guide you through this and then help you make an informed decision when it comes to the disaster of choosing, I chose a Medicare Advantage plan that I shouldn't have, or I chose a Medicare supplement and I'm just not aware of how the coverage works. Don't get yourself into a situation where a disaster occurs. Be educated correctly on the front end, and then enrolling in the right plan is key. Until next time, guys, give us a call. We'd love to be able to help.